Are you a diabetic? Have you ever checked your feet for various diabetic foot conditions? I'm Dr. Sanjay Sharma, a podiatric surgeon practicing in Bangalore since last 12 years. I treat diabetic foot patients and various foot and ankle conditions. If you are a diabetic, three things can happen in your feet. First, what we call it as diabetic peripheral neuropathy, where the nerves gets degenerated and it stops working. Second is the blood circulation gets compromised in your feet. It gets lesser and lesser blood circulation into your feet. The third thing, the shape of your feet changes. Either it can become a high arch feet or it can become a flat feet. In diabetic peripheral neuropathy, the nerve starts degenerating and causes various symptoms. Burning sensation in the feet or pricking sensation in the feet. It like ants crawling on your feet like this, or it could be walking on a soft surface, or various other symptoms. We call it as altered sensation. Or for some people, it could be no sensation at all. Like if you walk on a hard surface, you don't feel the hardness, or if you're walking on a hot surface, you don't feel the hotness. There is no sensation at all in your feet. Or driving the car, the accelerator is not felt properly, or if you're riding a bike, the brakes are not felt properly. These are the various symptoms that we see in diabetic peripheral neuropathy. Coming to blood circulation issue that we see, or what we call it as a peripheral arterial disease, where the blood supply into the feet doesn't happen. The early signs of this are changes in the color of the skin and loss of hair in the lower limb and around the ankle region. So if you're seeing something like this, we need to suspect peripheral arterial disease. We also see a lot of pain in the lower limbs and the calf muscles, and it is not related to your walking or strenuous running or work or something like that, because if you have a blood circulation issue in your feet, then there will be pain in your feet which gets relieved on sitting and probably increases while you are sleeping. The last part of it, when I said the changes in the shape of the feet, it changes because you have peripheral neuropathy, and it becomes a high arch feet where your body weight is distributed only in a certain areas of the feet. That makes it difficult for you to walk and causes what we call as diabetic foot ulcer, which becomes a non-healing ulcer as we proceed further. The treatments of all these conditions are spread across from conservative to surgical management and few of the new age interventions. If we come to peripheral neuropathy, that is the nerve condition that happens because of diabetes. Most of the nerve conditions are treated by the medications that we prescribe to you. And in a few extreme cases, there are certain stem cell therapies that can be done, a minor surgical procedures that can be done, or spinal triggers that are put into your spine. But most of them are treated with medications itself. The second condition that we are looking at, where there is a blood circulation issue into your feet, early on we can treat it by medications like blood thinners or antiplatelets, and once it is beyond the medication, we do angioplasties into the feet, which is similar to the angioplasty to the heart, where we ensure that the flow into the feet happens. If this is also not possible for a particular patient, then we have stem cell therapies which will regenerate the arteries in your feet. The last but not the least, where the changes in the shape of the feet is considered, footwear or customized insoles is the primary intervention to ensure that the ulcers do not happen. And if the footwears are not working for you, then there would be surgical interventions where we reconstruct the feet or make certain minor changes in the feet so that the ulcers do not happen. If the diabetic foot ulcer has already happened in your feet, then offloading footwear would be the key, along with various dressings and the treatments that we give for a wound itself. There are various other treatment methodologies to treat an ulcer and to ensure that we prevent amputations, and these things we will see in the further videos. If you have any questions about the diabetic foot conditions, please comment on this video and I'll be happy to answer them. If you like the information that we have been sharing in this year, please like this video, share this with your friends and subscribe to our channel.